pulse racing, heart steady, thoughts sharp, yet your body might be sounding an alarm you never learned to hear. Many people go through life feeling tired, foggy, achy, or just off, and they shrug it off as stress, age, or a bad night's sleep. What most don't realize is that these subtle warning signs can point to a hidden risk few doctors talk about early enough. In this video, you will learn what this silent threat really looks like in everyday life, why the usual checkups often miss it, and the exact signals your body sends long before serious problems take hold. You will discover clear, factual explanations about how common lifestyle patterns, small symptoms, and overlooked blood markers can add up to a major health issue if ignored. This is not about fear or exaggeration, it is about empowerment and awareness. You will also learn why conventional advice like just eat better or get more sleep barely scratches the surface when it comes to preventing this condition. By the time this video ends, you will understand how this warning connects to things you might experience every day without linking the dots, and you'll be equipped with real reasons to pay attention now rather than later. Staying tuned until the end is important because I will break down complex health science into simple ideas that make sense without confusing jargon, so you can recognize patterns in your own life. You will also hear about real consequences people face when this warning is missed too long, and the early steps you can take today to protect your health. There is a reason this topic is not front and center in most health conversations, and we will explore that too, not to criticize, but to reveal gaps in awareness that matter to you. For anyone who wants to take control of their body's signals and avoid months or years of decline before a diagnosis, this video will be eye-opening. Welcome to our channel, where we bring you clear health truths that matter, explained in a simple way you can follow. If you appreciate honest, deep-dive health guidance that goes beyond the usual surface tips, make sure to subscribe now so you never miss a video like this one. Let's get into it and uncover what your body's been trying to tell you. Your body sends signals every day, but most people never notice the pattern behind them, so small warnings get buried under busy routines and daily stress. Many people wake up tired even after a full night's sleep, struggle with low energy in the afternoon, feel foggy in the mind, or notice little aches that come and go without reason. Often these signs are dismissed as normal or blamed on workload, age, or bad habits, so they never get the attention they deserve. What most people do not realize is that these common symptoms are not random misfires of the body, but early whispers of a deeper imbalance that can grow quietly over time. Fatigue that lingers after rest, sleep issues that don't improve with better bedtime routines, recurring brain fog that clouds clear thinking, subtle pains that don't show up on an X-ray or an exam. These are not just minor annoyances, they are clues. Most people miss this warning because they are told what is normal and what is serious only when the problem is already advanced. Most routine doctor visits focus on urgent problems, blood pressure, standard lab work, and visible signs, but they rarely connect the dots between persistent, low-grade symptoms and what could be a significant health shift happening inside the body. The hidden health warning that few doctors emphasize early on is a gradual change in how the body handles energy production, inflammation, and recovery, a change that long precedes major illness. This silent shift can be described in simple terms as the body struggling to balance key systems that keep you alert, strong, and well. For example, when the body's internal signals for hunger, energy use, immune response, and stress management are out of sync, it can lead to things like chronic inflammation, metabolic strain, and hormonal imbalance. These are not dramatic diseases that appear suddenly, but slow evolving changes that most checkups do not flag because the standard tests doctors use often look only at numbers within a normal range, not patterns over time or subtle shifts from a person's baseline. Many lab results can show normal, yet underneath the surface your body may be compensating, juggling systems to keep you functioning even while something is deteriorating. A doctor might see your blood sugar as technically acceptable and tell you nothing is wrong when in reality your body has already started to struggle with managing insulin and energy levels. The early stages of this warning are easy to overlook because the symptoms are not dramatic, they are easy to explain away, and they do not trigger alarm bells in a typical medical screening. People who feel tired all the time might think they just need more coffee, or someone with mild joint stiffness might assume it is old age or overexertion. Someone who can't think clearly at times might blame stress, lack of sleep, or the pace of modern life. Yet when doctors do not dig deeper into how these symptoms connect and build over time, the underlying issue continues to grow without anyone noticing. That is why early detection matters so much, because when these patterns are identified sooner, the course of imbalance can be slowed, corrected, or even reversed long before serious disease takes hold. Ignoring these early signals is like hearing a warning light on a car dashboard, but continuing to drive because the engine still seems to run fine. The longer the problem is ignored, the more likely it is to advance into something more disruptive, requiring stronger interventions, medications, or even invasive treatments. This hidden health warning impacts millions of people who think they are just going through the normal ups and downs of life, unaware that persistent fatigue, sleep disturbances, mental fog, subtle aches, and fluctuating digestion are connected pieces of a larger puzzle. What doctors do not always tell you is that modern medicine excels at diagnosing diseases that are already full-blown, but it is not as focused on catching the slow, quiet shifts that lead up to them. The way most checkups are structured, unless a symptom is severe or an obvious marker is off the chart, the deeper imbalance remains unaddressed. Routine tests might show normal cholesterol ranges, normal thyroid numbers, normal vitamin levels, and yet you can still experience ongoing imbalance because what is considered normal in a lab does not always mean optimal for your individual body. A person can be within the average range but still far from where their own body functions best. The subtle disconnect between symptoms and test results is why most people walk away from appointments without clarity, relief, or a real explanation for how they feel. They leave with generic advice like eat better, exercise more, or relax, which may help a little but does not solve the root cause that links these symptoms together. The hidden risk is not a mysterious disease with a dramatic diagnosis, but a gradual deterioration in metabolic and inflammatory balance that quietly weakens the body's resilience. It affects how the immune system responds, how energy is produced and used, and how well the body repairs tissue after everyday stress. Because this process unfolds slowly, few doctors emphasize it in early stages, and most people stay in denial of what their body is really signaling. Yet these quiet changes matter deeply, because they shape how the body will function months and years from now. Recognizing the connection between those common, easy-to-ignore symptoms and the larger health picture is the first step toward awareness, better prevention, and taking control before the problem escalates. This is the hidden health warning that most people never hear about until the imbalance has become much harder to reverse. And this video is dedicated to making that connection clear, using simple language you can follow and understand.
Signs of a deeper health issue often appear quietly and subtly, woven into the fabric of everyday life in ways most people dismiss as normal ups and downs, yet they carry significant meaning if paid attention to. Low energy that leaves you dragging through your day, feeling like even simple tasks take more effort than they should, is one of the earliest indicators that something is off balance inside your body. Mood swings that come and go without a clear cause, irritability that seems stronger than usual, or periods of unexplained sadness or anxiety are another layer of warning that can be connected to underlying metabolic and hormonal shifts. Minor digestion issues such as bloating, irregular bowel movements, heartburn, or occasional stomach discomfort are often ignored because they seem fleeting or sporadic, but they can signal that your body is struggling to process food, absorb nutrients, or manage inflammation effectively. Recurring infections, colds that linger longer than normal, or skin irritations that do not fully resolve are also subtle signs that your immune system is under strain, quietly signaling imbalance long before a major illness emerges. Many people overlook these signs because they are small, inconsistent, or easy to rationalize, but when they persist over weeks or months, they form a pattern that is worth noticing. If these signals are ignored, the body often compensates internally, masking the problem temporarily while the underlying imbalance intensifies. This compensation can lead to escalating fatigue that becomes more persistent, deeper mood fluctuations, more pronounced digestive disruptions, and a weakening immune system that makes minor infections more frequent or harder to overcome. Over time, what starts as subtle and easy to ignore can progress to more serious complications, such as metabolic strain, chronic inflammation, or early organ stress. The gradual accumulation of stress on these systems can quietly damage tissues, affect energy production, and impair vital functions long before any dramatic symptoms appear. Early attention matters because it allows the body to be supported and corrected before this quiet deterioration becomes serious and more difficult to reverse. If these early warnings are caught and addressed, it is often possible to prevent a cascade of problems that would otherwise lead to long-term fatigue, reduced cognitive clarity, weight fluctuations, higher susceptibility to illness, and more serious conditions like diabetes, heart stress, or liver dysfunction. Prevention is far more effective and manageable than trying to fix a problem after it has fully developed, because the body's natural balance is easier to maintain than restore once it has been disrupted for a prolonged period. Simple actions taken consistently can make a remarkable difference in supporting the body's natural defenses, improving energy, mood, and digestion, and reducing the risk of serious long-term consequences. Blood tests and routine screenings can be tailored to check for subtle imbalances, nutrient deficiencies, or markers of inflammation that often go unnoticed in standard evaluations, providing concrete data that shows the body's internal state more clearly. Adjusting lifestyle habits such as improving sleep quality, incorporating movement and exercise appropriate to your energy level, and reducing chronic stress through mindful practices, breathing exercises, or short daily routines can dramatically support the body's resilience. Dietary changes, like focusing on whole foods, balancing protein, healthy fats, and complex carbohydrates, reducing highly processed foods, and staying hydrated, also strengthen metabolic function and digestion. Paying attention to small lifestyle details, including consistent meal timing, avoiding prolonged periods without nutrition, and moderating sugar or caffeine intake, can prevent spikes or crashes in energy that exacerbate fatigue or mood instability. Even minor adjustments, like taking short walks during the day, stretching after long periods of sitting, or setting a bedtime routine that promotes restorative sleep, have a significant cumulative effect over time. Managing stress proactively through daily relaxation practices, journaling, or meditation strengthens the nervous system and reduces the impact of cortisol, which affects both energy and immune function. Supporting digestion with mindful eating habits, such as chewing food slowly, spacing meals evenly, and including fiber-rich foods, helps the body absorb nutrients effectively, maintaining steady energy and reducing bloating or discomfort. Monitoring personal patterns, such as noting times of fatigue, mood changes, or digestive irregularities, can help individuals recognize their own early warning signals and take targeted action before problems escalate. These simple practical steps are not overwhelming, but they require consistency and attention, which is why they are so powerful in preventing more severe health issues down the line. By combining small but meaningful adjustments in diet, activity, rest, and awareness of subtle body signals, it is possible to reduce the silent strain building inside the body and maintain a higher level of energy, mental clarity, and overall well-being. This approach allows people to act before fatigue, mood swings, digestion issues, or recurring infections become entrenched problems that require medical interventions. The key is understanding that even minor, everyday symptoms are rarely random and almost always have an underlying reason that can be addressed effectively if noticed early. When these small signs are taken seriously and simple actions are implemented, the body often responds positively, restoring balance gradually, improving energy levels, stabilizing mood, enhancing digestion, and reducing the frequency of infections. Paying attention to these patterns transforms vague discomfort into actionable information, giving people a chance to prevent serious long-term consequences and maintain control over their health. This is why the focus on early recognition, simple lifestyle support, and subtle symptom monitoring is so essential, because the window for effective prevention exists before the body reaches a point where treatment becomes more complex, costly, or invasive. Simple steps like checking blood markers periodically, making small but consistent dietary improvements, staying active, prioritizing sleep, and managing stress build resilience in a way that compounds over time, protecting not only current health, but future vitality. Understanding these connections and acting on them empowers individuals to notice their body's warnings, intervene early, and maintain a higher quality of life with fewer disruptions and risks. Even actions that seem minor at first, when applied consistently, create a foundation that the body can rely on, reinforcing its natural systems and reducing the likelihood of chronic fatigue, organ strain, or persistent mood and cognitive disruptions. Recognizing the cumulative effect of subtle imbalances is the first step toward long-term prevention, showing that attention, consistency, and practical interventions are far more powerful than ignoring the body's quiet signals.
Your body has been trying to tell you something all along, sending quiet signals that are easy to ignore but impossible to dismiss once you understand their meaning. Fatigue that lingers, mood swings that come and go, digestion that feels off, and recurring infections are not just random annoyances, they are warnings that your body is under silent stress, and early attention can make all the difference. The sooner you recognize these signs and take small practical steps to support your health, the better you protect yourself from long-term issues that could be much harder to reverse. If you found this video helpful, make sure to like it, subscribe to the channel for more simple and powerful health truths, and share it with someone who might need this warning before it's too late. Stay tuned, because in the next video we'll reveal the top 3 foods that silently harm your health, and understanding them could change the way you eat and feel every day. Don't miss it, your body is sending the signals, and now it's time to listen.